Okay, hi. I generally do audio lectures, but this time I'm gonna do video lecture as well. Okay. So today we will be doing a very quick recap slash lesson learning of the thigh region. So what are all the aspects that we will be seeing? We will be seeing the hip bone, the femur, the tibia. First, we will see the hip bone and the femur, and then we will see the tibia and the fibula later on, which means tomorrow. So, today, our agenda is to complete our hip bone, the femur, and the medial part of it. Okay, so these are the three things that we will complete before seeing a movie. Okay, these are the three things that we will try to complete today. Tonight, if possible, this is what we have an agenda to complete. It's more like a revision, so we will be going quick only, except for femur. Femur we will be learning in detail, but apart from that, we will be going a bit quick only. Okay, and then if possible, towards night, we will also be seeing front of thigh. Okay, again, or we will handle gluteal part today. Okay, so these are the four topics that three are important. The other one, if possible, we'll complete it today. If we complete gluteal, a major part of it is completed. Tomorrow we can complete our front area and the back and the popliteal surface and tibia. 4. So we're gonna divide it into 4 parts each. So yeah, that will do. Okay, so today we will be seeing first we will be seeing the hip joint. Okay, so we will be seeing hip as a whole. So when we talk about hip as a whole, I don't have a bone with me, so bear with me, we're gonna imagine it. Okay, so what is it actually gonna look like? Okay, I got an atlas. We will look at it. Okay, we'll look at the atlas, no problem with that. So when we talk about the hip, okay, it's gonna be formed using 3 bones. Okay, it is a combination of 3 bones. What are these 3 bones? We've got the ilium, which is the top part, the pubis in the front, and the ischium in the back. Okay, so the ilium, the pubis, and the ischium at the back. So this is the 3 parts of the hip. Okay, so when we talk about the ilium, okay, it's got 2 surfaces. It's got the gluteal surface, which faces the gluteal maximus, medius, and minimus in outside to inside order. We have got the iliac fossa, which faces the visceral organs, and on top we have got the iliac crest. The iliac crest, the iliac fossa, and the gluteal surface. Okay, so these are the 3 major parts, 2 major surfaces of the ilia and the upper border. Okay, so when we talk about the gluteal surface, so it is divided into 4 major areas based on like 3 lines that are present. So we got the posterior gluteal line, the anterior gluteal line, and the inferior gluteal line. See how my hand moves. Okay, so if this is the gluteal surface, this is going to be the posterior, this is going to be the anterior, and this is going to be the inferior. Okay, so how many areas do we get? We will be getting 4 areas, right? We will be getting 4 areas. So we will be getting the area behind the posterior gluteal line. We will be getting the area between the posterior and the anterior gluteal line, one between the anterior and the inferior, and a small area between the anterior and the lower border of the ilia. Okay, so these are the 4 regions, which means there are going to be 4 there are going to be 4 attachments to these areas. Let's have a small glimpse of what are all the muscles that get attached to these areas. So mostly it's going to be from the gluteal aspect only. So what are all these 4 muscles that we that get attached to it? So it is going to be one of the 4, right? It's going to be one of the 4 only, which is like, the gluteus maximus, the gluteus medius, and the gluteus minimus. So the gluteal maximus is going to get attached to the between the posterior gluteal line and the area behind it. The gluteus medius is going to get attached between the anterior and the posterior and the anterior gluteal lines, and the gluteus minimus is going to get attached to the anterior and the inferior. Okay, the posterior, anterior, inferior. So the gluteus maximus, the gluteus medius, and the gluteus minimus. Okay, and in this small area, it's not going to attach anything at all. It's just going to be the continuation of it. So that's the thing. Okay, so these are the various areas that are present. Okay, so look at this picture. Okay, so this is the gluteal surface, that is the posterior surface. So the gluteal surface is going to be present there, and the acetabulum is going to be present there. Okay, that is what the acetabulum should always point outwards. So above that is what we have got the gluteal surface. So we have got the posterior gluteal line. Yeah, we have got the posterior gluteal line. Everything attaches to the sciatic notch. Okay, the posterior, the inferior, and the anterior. It's not visible with me. Okay, clearly not. Fine. Okay, this is a lot more better then. So we got the posterior gluteal line, the anterior gluteal line, and the inferior gluteal line, as I told you guys. Okay, so that completes the gluteal surface. Now moving on to the iliac surface. Okay, so when we talk about the iliac fossa, it has not got any subdivisions per se. Okay, but it's got the various borders. So iliac fossa, we have got the anterior border from the anterior superior iliac spine to the anterior inferior iliac spine. Okay, the anterior superior to the anterior inferior. So you got to remember there are going to be attachments for the anterior superior, for the anterior inferior as well. So there are going to be attachments based on this. So the anterior border from the anterior superior to the anterior inferior, the posterior border from the posterior superior to the posterior inferior. Okay, it's going to be like that. And then we have got the dorsal portion, we have got the ventral portion, we have got the dorsal portion. So the ventral portion is, there is going to be an iliac crest of sorts. Okay, there's going to be an iliac crest of sorts which is like 5 centimeters behind the ASIS, correct? It's going to be 5 centimeters behind the ASIS, and it's going to be a little elevated. So if it's going to be a little elevated, that's called a crest. Okay, so this is called as the tubercle of iliac crest. Sorry, this entire thing is called the crest. So that is called as the tubercle of iliac crest. Okay, so so that's going to be the anterior border, that's going to be the posterior border, and that's going to be a medial border. Okay, the medial border is going to divide it from the sacropelvic region. The sacropelvic region is going to be there, and the anterior iliac part is going to be there. Now, for example, let us look at this. Okay, I need a better picture. We do not have. Okay, so let's imagine. Okay, so how is the bone going to be like? It's going to be like this. So my hip is like this, so it's going to cover it like this, and when we look at the back, it's going to attach to the sacropelvic region, correct? So over here it should be the sacropelvic region, and it's going to come like this, and it's going to come like this, right? So this entire thing is going to be the iliac, gluteal surface, iliac surface and all. So a little like this, and it goes like this. So this line is what divides it from the, this is what is the medial line. Coming down, how does it look like? It's going to go and come out like this. Okay, okay, so we have got the, what is this? This is this one, the sacrum part. Okay, so we have got the surface like going like this, and then it is gonna come down, and it's gonna form the pubis over here. Correct? The pubis over here. So a little like this, we have got the inferior ramus, the superior ramus, and a hole like this, the obturator foramen. From here, it's gonna come like this, and this is gonna be the ischium. This is gonna be the ischium. This is gonna be the pubis, the inferior ramus, the anterior ramus. Okay, so that's how it's gonna work. So, do we have a picture of the gluteal lines are there? Okay. So look at this. I'm not sure whether it's actually understandable, but yeah. So this is gonna be the pubis. This is gonna be the pubis area, the one in the front. Okay, and then it moves from the front. It goes like this to the sacrum, and it gets attached like this. So yeah, here is the sacrum part. Okay, so that's how it is. So the medial line is gonna be like that. Okay, now moving on forward. So as I told you, the iliac crest has got a ventral part and dorsal part, right? So the ventral part is gonna have two things. It's gonna have the inner lip, the outer lip, and the intermediate lip. The dorsal part is gonna have an outer slope and a lateral slope and a medial slope. Okay, the lateral and the medial. Okay, that's how it works. And then when we talk about it, yeah, so the ventral is gonna be 2/3 and the dorsal is gonna be 1/3. That is also another thing that you need to know. And then this ilia, okay, what is this gonna do? Ilium is gonna form 2/3 of the acetabulum. It's gonna form 2/3 of the 2/5 of the acetabulum. Okay, so moving on forward to the gluteal. So we have completed the gluteal lines as well. So the sacropelvic lines is also completed. Now iliac tuberosity just below the ilium, dorsal surface. Okay, so we have seen the tubercle of iliac crest, right? We have seen the tubercle of iliac crest. Now we need to see something called as the iliac tuberosity. Okay, so where was the tubercle of iliac crest? On the iliac crest, right? It was on the iliac crest. Whereas the iliac tuberosity is, where is the iliac tuberosity? Oh, okay, it's on the dorsal surface. Okay, it's on the dorsal surface. So the tubercle of iliac crest is in the front. Okay, the tubercle of iliac crest is in the front, whereas the iliac tuberosity, which is a lot more bigger than that, is gonna be in the back. Okay, a rough ridge-like structure is gonna be the iliac tuberosity. Okay, so this is about the sacrum, the sacropelvic region. Okay, we're talking about the sacropelvic region. So first off, we have completed the anterior surface, the iliac fossa. We have completed the gluteal surface. Now we are talking about the last surface that is left, which is the sacropelvic surface. So this sacropelvic surface has an iliac tuberosity. Okay, it has an iliac tuberosity, and not just that, but what else is it going to have? An ear-shaped auricular surface, which is what attaches to the sacrum. Okay, so this is how it works. Now next, moving on forward to the pubis. So when it comes to pubis, I generally draw this one diagram which kind of like helps me out. And what is that diagram? It is just a line, a square, and this, and one line like this, and it goes like this. Another line like this, and it goes like this. We will see what it means. Okay, we will see what it means. But I hope you understood what I mean by this. Okay, so this is what I do to remember pubis. So what is it? So first off, we have got the square region, which is the body of the pubis. Okay, that is going to be an anterior surface. This is going to be the what is that? This is gonna be the attachment of the auricular surface with the other pubis. Okay, this is where it attaches. So this is gonna be the auricular surface. This is gonna be the superior surface, and over here we have got the tubercle, pubic tubercle. Okay, important. Why? Because from here to here is where the adductor longus is gonna get attached. The top part is where the adductor longus is gonna get attached. Between the angle of the pubic tubercle and the pubic symphysis is where the adductor longus is gonna get attached. Okay, this is gonna be the body, the anterior surface. Okay, the anterior surface along the inferior, and then the ischial pubic tuberosity is where the adductor minimus is gonna get adductor longus, adductor brevis is gonna get attached. Okay, this is how the adductor brevis is gonna get attached, and then inferomedially superior, I mean from the ramus, we will see the attachments later on. Is how the adductor magnus is gonna get attached. So you understood that this is gonna be, so what are all the various parts of a pubis? Then it is gonna be smaller in size. It's gonna be placed anteromedially. Okay, it's gonna be placed anteromedially. It's gonna have two arms, the superior arm and the inferior arm. Okay, it's gonna have the superior ramus and the inferior ramus. So the body has got the superior part, which forms the pubic crest. This is the pubic crest. In the pubic crest, we have got a pubic tubercle. So we have got an anterior surface. Okay, anterior surface is rough supromedially. It's rough over here, supromedially, whereas everywhere else it's just smooth. Okay, and then the posterior surface, anterior, posterior. The posterior is smooth only. Okay, the posterior is going to be smooth only, and then this is the posterior, this is the anterior. The anterior is going to be rough supromedially. The posterior is going to be smooth only because obviously it's going to face the viscera. And then what else? The medial or the symphysis. Okay, so what are all the parts? We have got the medial or the symphysis, we have got the pubic crest, we have got the pubic tubercle, we have got the anterior surface, and we have got the we have got the posterior. This is going to be the posterior surface, and that's it. This is going to be the posterior surface. So this is going to be the inferior ramus, this is going to be the superior ramus. These are the various parts that we have got. Okay, so when we take a look at the superior ramus, what are all the various parts that we have got? So the superior ramus is going to have a line called as the pectineal line. The crest of the superior ramus is going to be the pectineal line. So over here we have got a dorsal, obturator, we have got the anterior border. Okay, the anterior border. This region is going to be called as the pectineal surface. This is going to be called as the obturator surface because this is going to be the obturator crest. Why? Because there is going to be an obturator foramen over here. Okay, remember that this is a pubis. This is the pubis. There's going to be an arm and there's going to be an arm. And from these two arms, it's going to get connected. Almost like my body. If I were to hug, so what do? This is going to be my pubis, my arm, ramus, correct? It is going to get attached to the ischio. So it's called as the ischiopubic ramus, and it's going to get attached to my ischium. That's how it works. Okay, so now you have seen pubis and you have seen the arm. So what are all the parts? We have got the anterior surface, we have got the anterior border, we have got the pectineal line, so the pectineal surface, we have got the obturator line, so we have got the obturator surface. Okay, next, moving on to the down or the inferior ramus. So when we talk about the inferior ramus, it is conjoined. The inferior ramus is the one that is conjoined with the, it's gonna get conjoined. Look at this. I hug someone like this. Okay, I hug someone like this. So let's imagine that this is the thing. Okay, let me keep it like this. Okay, this works. Yeah. So let me keep it like this. So my my inferior, okay, is gonna get attached to my, what is this, ischium, whereas the superior is not gonna get attached at all, but rather what it is gonna happen is that, look, it's gonna get attached to the ilium. Okay, it is gonna get attached to the acetabulum. It's gonna get attached to the ilium. Okay, that's how it works. Yeah, it gets attached to the acetabulum. Okay, now moving on forward, let's make sure that we complete this by 30 minutes, 10 more minutes. We'll make sure that we complete this because we need to move on forward as well. Okay, so with that, we are done with the parts of pubic. So we have completed pubis, we have completed ilium. Last part is going to be ischium. Okay, so when we talk about ischium, the ilium is going to contribute 2/5 of the acetabulum. Pubic is going to contribute to 1/5 of the acetabulum. The ischium is going to contribute to 2/5 of the acetabulum. Okay, so now when we talk about the ischium, where is it formed? So I had already said that there's going to be an obturator foramen over here, right? So the obturator foramen's last, or the posterior part, is what forms the ischium. Okay, the posterior border of the obturator foramen forms the anterior border of the ischium. Okay, so that is what it is. So when we talk about the ischium, I informed you about the drawing that I do for pubis, right? Just a square, a line, and then two lines extending. Yeah, when we talk about ischium, what is the, for pubis, that was the diagram for pubis. What is the diagram that I would do for ischium? Okay, what is the diagram that I do? A nose, okay, a smaller nose, a U, up, up, okay, calm down, nose, smaller nose, U, up, up. That's how I do it. Okay, yeah. So now nose, smaller nose, U, up. Okay, 3 up. So what are all the various parts of ischium? Okay, so the upper end of the ischium is gonna cause the 2/5 of the acetabulum. The lower end is gonna form the ischial tuberosity and one arm of the ischium. We will see that, don't you worry about it. Okay, so wait. Okay, look at this picture. Okay, so this is gonna form the ischium. Okay, so this is the ischium. So the upper part of the ischium forms 2/5 of the acetabulum. So the ischium starts from here and it goes till here, not just from here, but rather from the part that it causes forms the acetabulum as well. So it starts from here and it goes till here. Okay, so as I had said, the nose, a smaller nose, a U, and like this. Okay, so we will see what that means. Okay, we will see what that means. So first, that's gonna be the nose, right? The larger nose. What does that mean? The larger nose is the ischial spine. Okay, the ischial spine, which is gonna cause the formation of the sciatic. It's gonna divide it into the greater sciatic notch and the lesser sciatic notch. Okay, so where is the sciatic notch actually seen? It's seen in the back. Okay, it is seen in the back. The hip bone, you will see it like this, almost like a butterfly structure. You will see it in the back. That is gonna be the iliac. It's gonna be the spine of ischium. Okay, ischial spine. And then next, so the posterior border is gonna be from the top through the ischial spine, bordering the ischial spine and going down a little bit. That's gonna be the posterior part. Okay, the anterior part is gonna involve obviously the posterior part. Why? Posterior na back, correct? Posterior na back. So this is gonna be the ischium. This is gonna be the ischial surface. Okay, facing the acetabulum, facing the obturator foramen, everything is gonna be like this. Whereas over here, it's just gonna be the greater sciatic notch and the lesser sciatic notch. So this is gonna be the posterior surface. This is gonna be the anterior surface. Okay, and then it comes down, and then it forms. What are all the stuff that is formed? Okay, so in this area, okay, in this area. Yeah, you're going to remember that the anterior border is going to form the posterior margin of the obturator foramen. That is understandable, right? That is understandable. Next, moving on forward, the posterior border is continuous above. It is continuous with the posterior border of the ilium. The posterior border of the ischium is continuous with the posterior border of the ilium. How does that make sense? That doesn't make sense, does it? I'll tell you how. Okay, so it's gonna pass through till the greater sciatic notch, right? Till the greater the ischial spine and a little bit above. That is into the greater sciatic notch. Where does the posterior border of the iliac spine actually happen? PSIS to PIIS, correct? PSIS to PIIS. I will show you where it is. See, it's clear over here. It's clear over here, very clear over here. Okay, so this is the bone, right? So maybe a little back. Okay, this is the bone. Okay, so you got the anterior part with the anterior anterior superior iliac spine. The anterior. This is gonna be the, what is this? A little above, right? So this is going to be the tubercle of iliac crest. This is going to be the anterior part. So it's going to have an inner lip, an outer lip, and a intermediate lip. And then from down there, we're going to have the anterior margin till the anterior inferior iliac spine. Okay, and then even further down, we're going to move down, down, down. And what is this surface? This is going to be the pubic. Okay, this is gonna be the pubic surface, and then we have got the superior rami. This is gonna be the pubic surface. Okay, this is gonna be the body of the pubis. What is this gonna be? Shit, this is the acetabulum. This is the acetabulum. Makes sense, right? Because why? Because it's gonna come from the ilium and it's gonna form the acetabulum. Okay, this is gonna be the acetabulum. This is going to be the pubis, superior ramus, the obturator line, the pectineal line. This is going to be the obturator line. This is going to be the anterior border. This is going to be the this is going to be the inferior. My hands are paining. The inferior pubic line, which is going to continue along with the ischium. Okay, it's going to form the ischiopubic rami. Okay, it's gonna form the ischiopubic rami, and where is it going? Back. It's gonna go back like this. Okay, like this. From the pubis, this part is gonna be the the inferior ramus, and from here it's gonna form this one. Okay, and then after going there, what is happening? It is going back, going to the ischial spine. Okay, it's going to the ischial spine. So again, moving backward. Till where did you reach? Where have you reached? Till here is the posterior border, right? A little above the ischial spine. So what is this? The PIIS. Okay, the PIIS. Yeah, it is a PIIS. Okay, this is going to be the sacral part. Okay, so this is going to be the iliac tuberosity. This is going to be the auricular surface, ear-shaped surface, and this is going to be the PSIS. Okay, with that we are done with the morphology of the bones. 32. Great. So we are done with the morphology of the hip. We are done with that. Okay, a quick recap, very quick. Almost I'd already done that, but let's do a quick recap. So we got the iliac fossa, we got the gluteal surface. So the iliac fossa is gonna have the ilia as a whole is going to have the iliac crest, which is going to get divided into 2/3 of the ventral surface, 1/3 of the dorsal surface. It's going to have the anterior superior iliac spine. Anterior border is going to come to the anterior inferior iliac spine, and then the ventral part is also going to have a 5 centimeter away from that. We are going to have the crest of the tubercle of the iliac crest. Okay, and then you come down, and then over there it's going to get divided. The anterior part, the ventral part is going to get divided into the inner lip, the outer lip, and the intermediate lip. And then you move down, you come to the posterior surface. Okay, it's going to get, the dorsal part is going to get divided into the inner slope and the outer slope. Okay, the medial slope and the lateral slope. And then we have got the posterior superior iliac spine moving down through the sacropelvic region to the posterior inferior iliac spine. Okay, posterior inferior iliac spine. Over here, from the posterior superior iliac spine to the posterior inferior iliac spine, on this side we are going to have what on this side, on the iliac fossa side, what are we going to have? We are going to have the sacropelvic region. We are going to have the iliac fossa, and on this side we are going to have, there's going to be a medial border as well. Okay, the anterior border, the posterior border, and the medial border, which separates the sacropelvic region. So the sacropelvic region is going to have an upper iliac tuberosity and a lower auricular surface. The gluteal surface is going to have 3 borders. It's going to have the posterior, the anterior, and the inferior. Okay, so these are all the parts of the ilium. Moving on to pubis, we have got the pubic crest, we have got the pubic tubercle, we have got the pubic symphysis, we have got the anterior surface, we have got the posterior surface, we have got the ramus. Superior ramus is going to get divided by the anterior border into the pectineal line. We are going to have the pectineal surface, and then we have got the obturator line, and then we have got the obturator surface, and then down there we have got the inferior line, inferior ramus, which is also going to get connected to the ischium, and it's going to form the ischiopubic ramus. Okay, so with that we are done with pubis. Moving on forward, continuing it. So the pubis is the superior part is going to get attached to the acetabulum. So the inferior part is going to get attached to the ischium. Okay, so when we talk about the ischium, how do we describe it? So we have got the ischial spine. The posterior line is going to start from it's going to start a little less than the ischial spine, and it is going to cross a little more, and it's going to reach there. Okay, so that's going to be the posterior line, and then it's going to have the ischial part of it. Okay, and then what is going to happen? It's going to have the ischioramus over there. Okay, and then over here, what is going to happen? Okay, yeah, over here we are gonna have the obturator foramen. The anterior part of it is the anterior border. Okay, the obturator foramen, then the acetabulum, and that's how it works. That is how it works. Okay, so this is gonna be the ischial part of it. With that, so the ischial part of it is the ilium spine. Ischial spine is the one that divides the greater sciatic knots and the lesser sciatic knots. The ilium is going to provide 2/5 of the acetabulum. The ischium, 2/5 of the acetabulum. The pubis, 1/5 of the acetabulum. With that, we are done with the hip bone. Okay, it's a large irregular bone. Done.